Газим, мне надо чтобы видео было мне на лицо направлено, оно у меня в бок направлено.
Hello, good morning. Hello.
Good morning.
Good morning. I'm Ann.
Good morning.
Good morning.
So there may be something wrong in the connection. Hello?
Good morning. Do you hear me?
Yes, yes. Now I'm
Yeah,
hearing.
we can.
The model the mouse gastric gland, according to our experiment. So it survives for more than 6 months in the stomach. You can imagine with the lifespan of the mouse, 4, 5, 1.5 years.
start already the work of the poster session. Sir Mahmoud,
Please, dear colleagues, switch off your sound. Gulnara Yaganovna, please switch off your sound. Thank you.
is it okay now?
Yes, it's okay.
Great.
Good afternoon, dear colleagues. My name is Gulnara Timirova from Aktobe, Kazakhstan.
Good day. Nice to see you, Gulnara.
The report will be present by co-author Aydana Janganayeva, Gaziza Jmagievna.
Aygana
Janganayeva.
Janganayeva.
Thank you.
Thank you. We may start.
Yeah, sure. Why not?
Are you ready to start?
Dr. Mahmoud.
Presentation. Aydana Janganayeva.
I understand.
Yes,
Good day, dear colleagues. It's a great proud and pleasure for me to be the part of a huge team of International Symposium of Morphological Science. You are a great team of big world of morphologists, and we waited for this meeting for a long time. It was long-awaited event, and now we have a great opportunity to join for a big panel of leaders in morphological science in researchers. And now we are open our part of poster sections with a presentation of Aydana Janganayeva from Aktobe City, West Kazakhstan Medical University. And please, presenter, to show your presentation and begin our poster section.
Thank you. Good afternoon, dear professors and participants. I'm co-author in this project, Aydana Mambarna, and I present you my poster, histological method for detecting bodies in the thymus gland. Relevance of scientific research, development of an effective method for staining preparation of the thymus gland for the detection of hostile bodies, and by increasing the temperature balance of the staining media. With increased temperature balance at the beginning of the staining of thymus sections, acceleration of staining is noted. Our material and methods, our research, a comparative assessment of the effectiveness of the developed method with the cooperation group 20 sections and the control group 10 sections, in which the developed method staining was carried out and traditional was carried out. Histological sections of the thymus are freed from paraffin in aromatic substance xylene and toluene. After that, it's washed well in distilled water. The preparation are placed in petri dishes for section staining. The technique of the developed method consists in preparing a coloring solution at the rate of 2 drops of azure to azine paint per 1 milliliter of distilled water, 27 degrees Celsius. The prepared paint is filtered through an ashless paper filter and poured into petri dishes, 1 section. Then the sections are left in the paint at thermostat temperature of 54 degrees Celsius for 45 minutes. Rinse thoroughly in tap water, 27 degree, and slice assure a sharply repainted appearance dark blue. Differentiate in water acidified with acetic acid at the rate of 1 drop of glacial acetic acid per 200 milliliter of water, heated in a thermostat to 37 degrees Celsius until clouds of blue paint azure leave and the cut turns pink. I show you results. Our method, histological sections were 20, our control group and experience group, and the groups were comparable in terms of the study period. The waxing of sections was carried out with silane. When using the developed method, the total time spent on staining the same sections was significantly 45 plus minus 1.2 minutes in the main group and 120 plus minus 5.1 in the comparison group. In the comparison group, during staining, most of the slides were emptied dye to the lot of sections from the slide, 50%. In the comparison group, out of 50%, in the remaining sections after staining, the percentage of differentiation of Hassel's body was only 50–60%. In the main group, in most cases, 19 and 95%. There was a better differentiation of little bodies in the field of use of the microscope. And in the end, the research results show the advantage of the development method, adjustable temperature balance of painting stages. Firstly, improving the penetration of paint into the team structure, and secondly, shortening the painting time by an average of 1–2 hours, and reducing the loss of sections during staining by 2 times, obtaining the quality of differentiation of Hassel's bodies, and safety, simplicity of execution, and economy. Thank you for your attention, and I'm
welcome. Great.
Thank you. Professor, do you have any questions, or participants, have you questions for the presenter?
Actually, the presentation was great. If anybody want to ask for any question, he can.
Mm-hmm. Please, the speakers, don't forget about the timing. You have only 10 minutes for your presentations. Be careful. And good luck to the second presenter, Rafik Nigmatulin from Ufa, Russian Federation, with the presenter of elastine structures. Please, you're welcome. We don't hear you, please. We see your presentation,
yes.
but don't.
Do you hear me?
Yes, yes, we hear you well. Please.
Respected chairmen, dear colleagues, let me present the results of our collective work performed at the All Russian Eye and Plastic Surgery Center. They are located tissue banking, universal tissue banking, and anatomical department, Bashkir Medical University. The purpose of our research is the development of new biomaterial for plastic reconstructive and regenerative surgery. Biomaterials based on connective tissue are widely used in modern surgery. Historically, there were two approaches to bioimplantology. First, its principle of allogenic transplantation. Second principle, it's the using collagen-based tissue. But it's very well known the transplant surface is a component by many medicine, medical, biology, and especially social problem. For example, religion, history, traditional, government rules, and another problem. You know, it's every morphologist knows that it's difficult to get the tissue for transplantation from dead body, from cadaver body, to produce the allografts. And we have taken as a basis as a principle of bioimplantology. It's xenogenic transplantation. Xenogenic transplantation open a new approach because it's possible to get the tissue for transplantation from different animals. And second principle, creation of biomaterials based on the elastic tissue. As a result, we have developed an original elastic biomaterial from the ligamentum nuchae of the bovine. Morphological and experimental study are required for each type of biomaterial. The presented biomaterial after transplantation to the recipients is replaced by the regenerative tissue. In the experimental, we were able to restore the following anatomical structure: bones, dermis, soft and lost connective tissue. Excuse me, it's my problem. Or not? The use of elastin biomaterial in the practice of traumatology, plastic surgery, craniofacial surgery completely confirmed our experimental data. And we have been conducting clinical trials of elastic biomaterial. It's very pleasant for me that in many countries now continues this investigation about the elastic collagen transplantation. For example, Australia, Brazil country elaborated new elastic biomaterials, but the record. And these biomaterials produced from different tissue, but our biomaterial, our xenograft from the ligamentum nuchae is original. Now my co-worker, Dr. Moti Gulin, is ready to give brief information on the poster presentation. Thank you for your invitation.
Thank you for introduction. Dear colleagues, can you hear me?
Yes, you can start.
Yes, we are here.
Part of the report will be about materials, methods, and the results of the research. So, for histological examination of elastin biomaterial, we used the electronic and reflected light microscopy. Histotopographic sections were stained with orsein and the Mallory and Van Giesen methods. The mechanical properties of standard samples of biomaterial we studied on a Zwick-Rowell universal testing machine under compression deformation. The strength of the suture fixation was determined by applying silk gauge number 7, departing from the edge of the sample about 2 millimeters with subsequent fixation on the tensile load. So, results of the study you can see in the pictures. In the middle picture, you can see described biomaterial. It's a polarizing microscopy staining by Mallory method. The biomaterial presented as a cellular heteromorphic matrix based on elastin fibers with a diameter nearly 6.5 nanometers with a predominant one-vector orientation, as you can clearly see in the picture. So, in the picture above, you can see the electronic microscopy results. It shows collagen fibrils and fibrillin microfibrils located between elastin fibers. They tightly connected with each other and elastin fibrils in different directions, so they forming lamellar structures. Results of the mechanical part of the study shown on the bottom diagram that shows deformation of deformation stress correlation of the biomaterial under compression. Dominance of elastin fibers in the structure of biomaterial provides a high modulus of elasticity. It's a young modulus. It's nearly about 1.74 newtons to millimeters squared. Amorphous matrix and fibrillary microfibrils between elastin fibers determine the viscous behavior of the biomaterial. However, elastic viscous features is observed while biomaterial stratificates along the collagen wires after increasing the tension, but its structure completely restores after removing the load. The fiber architecture of this biomaterial is also manifested in the rather high rates of suture strength. It's about 13.9 newtons. So, in conclusion, I would like to say that the obtained data of the morphology and biomechanical characteristics demonstrates a wide range of elastic deformation and strength features of united elastic collagen complex, which can be beneficial for reconstructive surgery. Dear college, thank you for your attention. If you have any questions, please ask it.
Thank you very much. Professor Mahmoud Batalla, have you any questions?
Thank you very much for this nice report. And I would like to ask you, my colleague, you apply your experiment or your study for how many cases or how many specimens you use?
For histological examination, we used standard samples of elastin biomaterial. It's 24 samples that we used to histological and microscopic evaluation.
Great, great. Thank you very much. If colleagues needs to ask any question.
You have an opportunity to ask questions also in chat in written form. Please use this additional tool to participate in our poster section, and please give all oral questions too. Thank you. And the next presenter is Gulnar Gavdulina from Nur Sultan, the capital of our Kazakhstan Republic, and her presentation is about the structures or some features of trunk-bronchial lymph nodes in fetus and newborns. Please, you're welcome.
Здравствуйте, уважаемые коллеги, уважаемые участники Международного симпозиума морфологических наук. Постерный доклад на тему трахеобронхиальные лимфатические узлы в раннем онтогенезе при хронической внутриутробной гипоксии. Перинатальная смертность при хронической плацентарной недостаточности составляет 10% среди доношенных новорожденных и 49% среди недоношенных новорожденных детей. Изучение морфологии лимфатических узлов в онтогенезе может дать представление о состоянии лимфодренажа и особенности формирования иммунокомпетентных функциональных зон лимфатических узлов в раннем онтогенезе при гипоксии у плодов и новорожденных.
Hi everyone, my name is Novik Varujan. Now I talk about in English. First, in background, we are perinatal mortality in chronic placental effusion is 10.3% among full-term newborns and 49% among premature infants. The study of morphology of lymph nodes in ethnogenesis can give understanding state of lymph drainage and feature of formation of immuno components, functional zone of lymph nodes in early ethnogenesis during hypoxia in fetus and newborns.
Методами исследования к ним исследованы трахеобронхиальные лимфатические узлы 48 мертворожденных и умерших новорожденных. 40 плодов и новорожденных имели состояние хронической внутриутробной гипоксии. Рассчитывали количество общей площади коры головного мозга к продолговатому мозгу и отношение удельной площади мозговых тяжей к мозговым синусам. Гистологические срезы окрашивали гематоксилин-эозином по вангизону, проводили гистохимические исследования, определяли индекс миграционной активности мелких лимфоцитов и использовали люминесцентную микроскопию и морфометрию.
Now let's talk about methods. Trachobronchial lymph nodes of 48 stillborns and descended newborns were examined. 40 fetus and newborns had a condition of chronic intrauterine hypoxia. It's a main group. Physiological course of pregnancy was observed in 8 cases, and ratio of absolute area of cortex to the medulla and ratio of specific area of cerebral cords to the cerebral sinuses. And we have also histological section where stained with hemaxylin iodine. Also, we are carried out histochemical studies. Index of migration activity of small lymphocytes was determined. Luminescence microscopy and morphometry were used.
Результаты. В основной группе в трахеобронхиальных лимфатических узлах кора была фрагментирована на небольшие участки, напоминающие лимфоидные узелки. Цитоцентров обнаружено не было. Лимфоидные узелки были обнаружены и в мозговом веществе. Краевые и промежуточные синусы лимфатических узлов были значительно увеличены. В лимфатических сосудах и синусах были обнаружены застойное скопление лимфоцитов. Значительные изменения клеточного состава выявлены во всех морфофункциональных зонах трахеобронхиальных лимфатических узлов. Наблюдалось значительное увеличение процента регенерирующих клеток. Количество плазматических клеток и макрофагов значительно уменьшилось, а количество ретикулярных клеток было значительно выше, чем в общей группе. И результаты гистохимических исследований свидетельствовали о снижении обменных процессов в клетках лимфатических узлов основной группы.
Now let's talk about results. In the main group on trachobronchial lymph nodes, cortex were fragmented into small areas, resembling lymphoid noodles. No light center were found. Lymphoid noodles were also found in medulla. Marginal and intermediate sinus of lymph nodes were significantly enlarged, and conjunctival assimilation of lymphocytes were found in lymph vessels and sinuses. Percentage of blast and cells with meiotic pyramids was significantly lower than in a general group. There are also significant increase in percentage of cell.
Выводы. Описанные морфологические изменения микроанатомической организации трахеобронхиальных лимфатических узлов основной группы свидетельствуют о развитии общего лимфостаза у плодов и новорожденных с хронической внутриутробной гипоксией, что свидетельствует нарушению формирования функциональных зон регионарных лимфатических узлов и реактивному воспалению в узлах. Изменение клеточного состава трахеобронхиальных лимфатических узлов свидетельствует о подавлении функциональной активности лимфоидных тканей, что подтверждается значительным снижением индекса миграционной активности мелких лимфоцитов в лимфатических узлах.
In conclusion, we talk about microanatomical organization of tracheobronchial lymph nodes of the main group, probably indicate development of general lymphostasis in fetus and newborns with chromatic intrauterine hyperchia, which contributes to the description of formation of functional zones of regional lymph nodes and reactive inflammation nodes. And also we talk about change in cellular combination of tracheobronchial lymph nodes showed suppression of the functional activities of lymph tissues, which confirmed by significant decrease index of immigration activity of small lymphocytes in lymph nodes.
И хочу выразить огромную благодарность организаторам за проведение симпозиума на высоком профессиональном уровне. Большое спасибо.
Thank you very much for your presentation, because it's a great problem with the gestational hypoxia because of the spread of anemia in Kazakh population of our country, not Kazakh, but of rural population of our country. And so it's a very interesting work. Professor, do you have some additional questions or remarks, please?
Thank you very much for the report, and appreciate it.
Thank you very much.
Газиза Жмагеевна, докладчик не включил свой.
Sorry. Sorry. Do you hear me? The next presentation is from Yerlik Serkesh of Nur-Sultan, Kazakhstan, and the poster is before you, please. You're welcome.
So, it's a great pleasure to present today. Thanks to the organizers of this symposium and the participants. We are from Medical University of Astana, Nur-Sultan City, Kazakhstan. And let me introduce you to our poster report on the topic of assessment of conformity of biological age to chronological data in children of Kazakh ethnic group in Astana. So, as a background, for many practical purposes, it is important to group children not by the chronological or passport, but by biological age. It means like according to the degree of development and as a result of the influence of external or internal factors, their chronological age may not correspond to the biological age. And to assess the biological age, there are three main criteria. The first one is the degree of somatic or skeletal maturity. The second one is the degree of development of secondary sexual characteristic. And the last one is the degree of dental maturity. And considering that, we studied children of primary school age. The most informative and accessible subject for our research was the timing of the eruption of the permanent teeth. The aim of the study was to assess the correspondence of the biological and the chronological age in Kazakh children of primary school age in Astana. As the methods we used 442 children of primary school age, there was 224 boys and 218 girls. They were surveyed in the period from 2016 to 2018. The determination of biological age based on the odontological science was carried out by the counting the number of eruption teeth and the sequence of their eruption depending on the age of the child. The data obtained were compared with the generally accepted, developed standards and as the result of which the interval estimation of the age of the individual was determined. As the result, we can say that the analysis of the data obtained showed that in the girls and boys, dental maturity reached its maximum values of the age of 9, and the difference in advancing dental maturity at 7 years of age is 4.7% in favor of girls, and at 8 and 11 years of age, the difference in advances was not observed. And at 9 years of age, girls are ahead of boys by 9.6%. And at 10 years of age, girls are 15.1% ahead of boys. The maximum percentage of lagging dental maturity in boys was noted at the age of 11, and in girls at the same age, it was 10.7 plus minus 0.1%. The lagging of dental maturity in boys at 7 and 8 years of age is 15 plus minus 0.3 and 11.2 plus minus 0.1% respectively, but in these age periods, the percentage of lagging in dental maturity is not observed in girls. And at the age of 9 and 10, we did not observe a lag in the development of dental maturity. The correspondence of biological and chronological age in boys and the girls is noted at the age of 8 in 19.9 plus minus 0.1 and 19.8 plus minus 0.07% respectively.
Excuse me, sorry for interruption, but I think the video in your side, maybe there is a problem. Can you just try to, because I think nobody can see you in the meeting.
Sorry, and my route was about this. Please, all participants, dear participants, switch on your cameras, your videos. Пожалуйста, включите свое видео, чтобы мы видели докладчиков наверху, там, где лента участников. Sorry, you can continue your presentation, but please switch on your video.
Так, я на данный момент не могу просто включить видео, придется перезаходить.
Окей, тогда продолжайте. Как закончите, включите.
Okay. On the table, for example, on the table 2, we can see the evaluation of the correspondence of chronological and biological age among the Kazakh children of primary school age in Nur Sultan in percentages. So as a conclusions, firstly, in 9-year-old girls, the biological age is ahead of the chronological one in 48.5 plus minus 0.1% of cases. And in boys, the highest advance rate is also observed at the 9-year-old age and is 38.9 plus minus 0.3%. Secondly, the maximum indicator of the lag in the biological development is found in both boys and girls at the age of 11. So that's all. Thank you for attention. It was a great pleasure to present a report.
Thank you for your presentation of your poster. And please, Professor, do you have any comments?
No, thank you very much. And we can ask the colleagues if somebody want to ask a question or any comment.
Please.
Thank you very much.
Thank you. If we have no any questions, the next presenter is Gulzira Sagimova from Nur Sultan, and her poster is about the changes in the cellular composition of the spleen. Please, you're welcome.
Good day, dear participants of International Morphological Symposium. Let us introduce you our poster presentation as changes in the cellular composition of the spleen of fetuses and newborns in early ontogenesis in histosis with anemia in pregnant women. Numerous immunodeficiency states in children are the result of underdevelopment in ontogenesis of the organs of immune system as a result of pathological conditions of pregnant women. Anemia in combination with histosis significantly increases the frequency of hemodynamic dysfunction in the mother placenta fetus system. The spleen is the site of a specific immune response to antigens circulating in blood, the structure and function of which change during ontogenesis. In our research, spleens from 30 stillborns and deceased newborns who developed during a complicated pregnancy with anemia and histosis were studied. They formed the main group, and comparison group or general group consisted of 8 cases with physiological pregnancy. Each group was subdivided into 4 subgroups. First and second are stillborns at 28-36 and 34-40 weeks of gestation respectively. And the third, fourth groups consist of newborns who died on first, fourth, and fifth, seventh day of life, respectively. The study was approved by ESIC committee, and we used the macroscopic study. We calculated the weight coefficient of spleen, which is expressed as the ratio of spleen weight in grams to body weight in kilogram. Eosin, azur-to-eosin, according to Van Hizon, food and histochemical studies were carried according to Brachet, Kurnik, Fjölgen, luminescence microscopy, and morphometry were used. Results of our study shows the fetuses and newborns with histosis and anemia of pregnant women are characterized by a sharp decrease in the content of lymphoid cells, both in the peripheral lymphoid zones and in the marginal zone in comparison with the control group. A persistent decrease in the percentage of small lymphocytes and a significant decrease in the number of medium lymphocytes, blast cells, mitotic cells, plasmacytes, and macrophages were determined. There is a persistent increase in the proportion of degenerating cells. Also, there is a significant increase in reticular cells, both in the marginal zone and in the periarterial zones. In comparison with the control group. Our data shows that in the main group, a persistent increase in small lymphocytes and macrophages in and decrease in the percentages of the plasma cells present. Therefore, it is possible that in histosis with anemia in pregnant women, there is a violation of the interaction of macrophages and lymphocytes. The histochemical picture of the spleen indicates a decrease in metabolic processes in the cells of the white pulp. There is a decrease in the activity of alkaline and acid phosphatase in cells of parenchyma and stroma of spleen, and a weak Schiff reaction in macrophages and reticular cells of white pulp of spleen of fetuses and newborns in perinatal period with histosis and anemia in pregnant women. And also our table shows that the weight of the spleen and weight coefficient of the spleen was decreased in all studied groups. The vessels of the parenchyma in the spleen are dilated, and there are the focal hemorrhages, which shows the stasis in the spleen, and also the area of the white pulp is decreased, and the peripheral zones are also small. And we can see enlarged the red pulp. which also shows the stasis in the spleen. And obtained data allow us to do the conclusion that changes in the cellular composition of various functional zones of the spleen of fetuses and newborns in early ontogenesis with histosis and anemia of pregnant women are expressed in a persistent decrease in the content of small and medium lymphocytes, blasts, mitotically divided cells, macrophages, and plasma cells, with a significant increase in the number of reticular and degenerative cells. In histosis with anemia of pregnant women, a decrease in metabolic processes in cells of parenchyma and stroma of spleen of fetuses and newborns are determinant. Thank you for attention.
Thank you very much for your very interesting presentation, because as I said previously, the histosis and anemia in pregnant women is very important problem for our country, because it is one of the main problems of maternal mortality. And if we know the anatomical features of this process, pathological process, it gives us more opportunity to treat these women. Thank you. And Professor, do you have additional marks or questions, please?
Great report, and also your comment is really appreciated. And yes, we have to track this population or this ladies before, because it's really serious. If there is like anemia, it leads to disaster. So we have to search for how to manage before it happens. Thank you very much.
Thank you so much.
Thank you. And the next presenter is from Orenburg, Russian Federation, Lyudmila Shalikova, and her poster is about the features of sacral spine. And please, you're welcome.
Good afternoon, dear colleagues. I am glad to present results of our research at the high-level conference. I have to say that this poster is just part of our large scientific work of our Department of Normal Anatomy of Orenburg State Medical University. And now I will say a little bit about sacral spine and neural pelvic structures. A few words about relevance. Why need we in knowledge of pelvic structures of the prenatal stage, and especially in the of the intermediate period from 14 to 28 weeks? We have a few reasons for it. Firstly, we have development of diagnostic methods, modern lifetime methods such as MRI, computer tomography, and ultrasound, because now we have a good possibility to identify different abnormalities of the fetal period in the second trimester of pregnancy. Second reason why this knowledge are necessary for us, because we have new patients now in the world. You know, they are deeply premature children of neonatal period, and you know that now in Russia we have these patients from 22 weeks, just 500 grams. And sure, for operate this baby or provide any techniques, we need no normal anatomy of this period, because just newborn anatomy, it will not be enough for them. And third, I think it's most important reason for this research is development of fetal surgery. You know that in the last 30 years, it's so highly development part of the surgery that allows to correct different malformations in the fetal period, such as spina bifid or teratoma, sacrococcygeal teratoma, or any different malformations of the pelvic region. That's why purpose of our study was identify anatomical and topographical specialties of sacral spine and chordae equina as part of spinal cord, and also sacral plexus, but we have just initial part of the sacral plexus and sympathetic trunk of this period of the development. That's why we our research was based on the study of the sectional material of 30 human fetuses. We use both sexes, male and female, for comparison. And I have to say that all these fetuses are from collection of our human anatomy department. And in our research, we used complex of morphological methods, it's classical methods, microscopic preparation, method of cards according to Piragov's, and histological methods. And what is about results? I can't show you because I can't I can't see, I can't use this option, but please look at the figure number 3, and you can see it's a sagittal cross-section of sacrum. It's our method according to Pirogov cards, and you can see it's a midline section, sagittal cross-section. You can see that sacrum in this period is formed by 5 separate vertebrae, as you see, and between you can see so thin discs, intervertebral discs. If you compare with adults, it will be more thin, and to prepare it was so difficult. And also you can see discs, no discs that place for bones. So we can say that it's cartilage tissue, but inside of the body we can see just before 4th sacral vertebra place for ossification. And we measured height and width of sacrum, and we have to say that it has so wide base and narrow apex, not such as adults. And also we can say that spinous processes that you can see on the dorsal surface are good visible, but what is about articular and transverse, they are weakly expressed. And also we can see that pelvic surface, anterior sacral surface, is concave, and also we can notice promontory because always we said that promontory is developed just in the neonatal period, but in all our cases, we could see this promontory, and this specialty change inlet of pelvis. We noticed it also. Also, we have to say that sacral canal gradually narrowing down from sacral 1 to sacral 5, and also we can see at the level at the figure number 1. Please look number 1 figure. You can see 4. It's sympathetic trunk, and more laterally we can see anterior sacral foramen, and through it you can see also large sacral nerves, anterior sacral branches you can see, and you can see that if you compare with other structures near of these nerves, you can see that it's so large. It's a specialty of fetal period because in the intermediate period we have development of neural tissue and especially formation of peripheral nerves. Also, we have to say about a specialty of terminal phylum. You can see on the figure number 3 by arrow, it will go before coccygeal 1 vertebra. And also, we have to say about differences of this period according to sacral plexus. Sacral spinal roots depart from spinal cord. You can see number 1 on the figure 1, where spinal cord, and on the lateral sides, we can see this spinal nerves. And again, we have to say about special features of this period, because it will be more inferiorly according to L5 vertebra, not L3, such as for adults. And also we have to say about large diameter of the sympathetic trunk nodes. And I want to notice that in the 6 weeks, this sympathetic trunk node is slightly pronounced, just to 22nd weeks, it will be good visible. And also we have measurement between all these structures, and especially neural structures with arteries and veins, such as on figure 2. You can see it's histotopogram. We used method by Van Hisen, and you can see relationship of nerves with the internal iliac artery of this period. And also, please, you can see on the figure 2, I'm sorry that I can't show you, but number 3, it will be node of sympathetic trunk anteriorly on the sacrum, yes, and posteriorly, if you look a little bit above of the disc sacrum, you can see ganglions in the sacral spine. That's all. About conclusion, I have to say that we hope that our data about morphometry and topography of the structures, pelvic structures and sacral spine will be used for doctors, different specialties, maybe fetal surgeons, or doctors of diagnostic. Thank you so much. I'm ready to answer on all your questions.
Thank you very much. I really appreciate it with your poster because this kind of anatomical researches push anatomy closer to clinical science and give the surgery the new approaches to do very modern surgical operations during pregnancy. And also I'm appreciated of using of complex of not only clean anatomical tools, but also new modern visual diagnostic methods tools. Thank you very much. And Professor, do you have any questions, please?
No, thank you for the report. Your report is really great, and usually the anatomy is the basics, so usually we have to consider everything regarding the basics, which is later on gives us focusing for the management and for the future. Thank you very much.
Thank you so much. Thank you.
Please, participants, if you have any questions, you're welcome. And the next poster will be from Baku, the capital of Azerbaijan, and presenter is Nigar Mustafaeva. And please, you're welcome. About the poster about the gender differences of the orbit, please.
Okay, my first words are words of welcome. Welcome all of you, and I'm very glad to take place in this conference. And about the background of my work, the orbit is an anatomical structure that has numerous communications with the areas of the facial and cerebral skull. For this reason, the physiological processes developing in the orbit are characterized by a variety of etiopathogenesis. The development of surgical and diagnostic ophthalmic technologies requires more detailed knowledge of the orbit morphology. According to above mentioned, the basis of this study was a comprehensive study of the gender differences of the orbit and craniometric indicators for various chronotypes. We studied the gender differences in structure of the orbit on 86 special selected skulls of different ages taken from the craniological collection of the Fundamental Museum of Human Anatomy and Medical Terminology of our Department of Human Anatomy of our Azerbaijan Medical University. And all measurements on skulls were performed by special tools used in modern craniology. And results, in addition to the age differences of orbit, we also learned gender characteristics, and it has been found that the longitudinal axes of the orbit in women are close to each other. Depending on the character of junction of orbit borders, each the entrance of orbit in males is rectangular shape, and in most cases in females it's round shape. Superior orbital fissure is slightly larger in men than in women, and to determine the sex differences in craniometric parameters of skull in men and women, in width and height of orbit, we were measured and the orbit index were calculated. In males of adolescents, young and mature age groups, the width of orbit is 1.6 times, and in males of senile age groups is 1.03 times more than in females. And in males, the height of orbit in adolescents, young and mature age groups is 1.07 times, and in senile age group is 1.04 times more than in females. As a result of our craniometric measurements, sex differences in the size of different walls of the orbit were revealed, and it was found that the upper wall in males is 53.7 plus 0.2 millimeters. The inner wall is 51.2 plus minus 0.5 millimeters. The lower wall is 44.5 plus minus 0.4 millimeters, and the lateral wall is 41.08 plus minus 0.3 millimeters. In women, the upper wall is 38.6 millimeters. The inner wall is 36.9 millimeters. The lower wall is 32.8, and the lateral wall is 27.9 millimeters. And the results of our research show that in men, the biorbital width of skull is 1.82 times more than the length of the upper wall of orbit. In women, this measure is 2.52 times greater. In men, the biorbital width of skull is 1.92 times more than the length of the inner wall of orbit. And in women, it's 2.63 times greater. And in men, the biorbital width of skull is 2.25 times greater than the length of the lower wall of orbit. But in female skull, the biorbital width is 2.96 times greater. The biorbital width of the skull in males is 2.35 times greater, and in females is 3.48 times greater than the internal lateral walls of orbit. And about conclusions, I can say that it was found the upper wall in males it's 33.7 millimeters, the lower wall is 44.5 millimeters, and the lateral wall is 41.8 millimeters. In women, these walls are lesser than in men. Upper wall is 38.6, inner wall is 36.9, the lower wall is 32.8 millimeters, and the lateral wall is 97.9 millimeters. The results of our research show that in men, the orbital width of skull is 1.82 times more than the length of the upper wall of orbit. In women, this measure is 2.52 times greater, and in men, the b-orbital width of skull is 1.92 times more than the length of the inner wall of orbit. In men, the b-orbital width of skull is 2.21 times greater than the length of the lower wall of orbit. In female skulls, the b-orbital width is 2.96 times greater, but the b-orbital width of the skull in males is 2.35 times greater, and in females it's 3.48 times greater than the lateral wall of orbit. The results of our measurements show that in all studied age groups, the orbit index is 1.05 times greater in women than the same measures of men, and we also conclude that the b-orbital width of skull is 1.82 and 2.35 times greater in males and 2.52 times greater in females than the length of orbital walls.
Thank you.
Finished.
Thank you very much for your presentation. I must say that ophthalmology is on the top of advanced surgical technologies, and knowing of classical anatomy structure of orbit is very important to do some ophthalmological procedures. And I have one question. Do you notice any correlation? Maybe you estimated some correlation coefficient that can help about the estimation of the age. Maybe you found unknown scalp and you want to know the age of this patient. May you approximately know the age of this unknown, how to say, body, and to estimate his approximate age? Thank you.
Thank you for your question. Thanks. We used during our works, we used all skulls from our department of human anatomy, because in our department there are more than 1,000 skulls, and we used all these measurements on skulls from our department. But also, I think that all these measurements we can use in practice too. But we use only skulls from our department.
Okay.
We subdivided all skulls into 2 groups for their age and all other groups.
Thank you. Professor, do you have any questions, please?
I would like to thank you very much for this great topic, and really it's interesting. But my question is, what is the significance? You did a lot of effort work for this measurements of so many orbits, but is there significant for in the future, or for the surgery, or for whatever, for the management of diseases, according to these differences in study? And what's the significance? What is the significance? Yeah, what's the significance of this measurement?
Thank you, Professor, for your question. I think that all these measurements we will use during some clinical operations on face, because from all these parts we know that some nerves, arteries pass, and all these measurements we can use during some operations near the orbital cavity. And
so it's significant with the surgeries,
in men and women. Yes, and differences in men and women, and about the walls, length of walls, different walls of orbital cavity, and their connection with other measurements too.
Good. Thank you very much. Thank you very much. You really
thank you.
Appreciate it.
Thank you. And we have the next participants from Baku, Azerbaijan. It is Ramila Babaeva and she presents her poster about the visceral branches of abdominal aorta. You're welcome, please.
Good morning, dear participants. I'm very pleased to be here with you, and this presentation is a part of my scientific work. And the presentation about the morphology and the function of impaired visceral branches of the abdominal aorta. The introduction about the occlusive lesion problem in impaired visceral branches of the abdominal aorta has accrued great social significance. Firstly, because the number of patients with abdominal ischemic syndrome increases as this pathology has been studied, it's necessary to allocate an independent nosological unit for ischemic disease of digestive organ. Secondly, that diagnosis and the treatment results remain unsatisfactory. The aims about the purpose was to study the morphology and function of impaired visceral branches of the abdominal aorta. And what about the material and the methods? The research was conducted on outbred dogs and located in the very of Samara Veterinary Clinic, France. All manipulations with animals were carried out in strict accordance with Russian and
Please switch off your microphones, only speaker. Please, you will
except
yes.
you, Dr.
Can you hear me?
Yes, yes, of course.
Okay.
Yes.
The methods is the research was conducted in on outbred dogs and located in the area of Samara Veterinary Clinic, France. And the method is impregnation, general histological and electron microscopic. Anesthesia, cyanoid sodium intraperitoneal, 50 milligram kilogram. And the anesthesia's depth was supported by an additional intravenous infusion. Median laparotomy, loops of the small intestine has been shifted to the left. The first jejunum artery was highlighted. Polyethylene catheter was inserted into it and advanced to the superior mesenteric artery. Then splenic artery was highlighted and the polyethylene catheter was inserted into it, advanced to the ostium of celiac trunk. The portal vein catheterization was carried out through one of the jejunum veins. The vascular resistance of the superior mesenteric artery system and celiac trunk was calculated as the ratio of the difference between arterial and the portal pressure to volumetric blood flow. Method was used to calculate the volumetric blood flow rate. For angiography, a 70% cardiac solution was used. As a result, the arteries located between on the plate of the intestinal mesentery are devoid of fascial cell vaginus, but surrounded by loose connective tissue and fixed to peritoneum, but both plates by collagen fibers. On transverse section, the lumen of the arterial arch and intestinal arteries of hungry animals is elliptical, and in station animals it's round shaped. The distribution density of direct arteries in different parts of intestine are varying considerably. In the proximal part of the small intestine was rectal supply with length of 4.2, an average of 7.2 millimeter, and in the terminal 10 millimeter. The conductor of arcade vessels is often disturbed. In areas of direct arteries entry and direct vein exit, the outer layer of muscular membrane. The muscular membrane of the direct arteries consists of 8-12 myocytes layers. They are fixed to opposite wall of the artery. What about the conclusion? Two forms of lymphatic capillaries have been found, blind beginning and open. Blind beginning lymphocapillary are central milky sinuses of the intestine villi, the lymphocapillaries of the submucous and intermuscular connective tissue. Vasoactive drugs of various pharmacological groups affect hemo and the lymphocytes in the wall of the digestive tract. And at the end, the significant blood flow in the visceral branches of the aortic abdominalis is affected by the total pressure of the truncus celiacus, the superior mesenteric artery, and the inferior mesenteric artery. Therefore, the regulation of blood circulation in the visceral branches of the aortic abdomen in different functional conditions of gastrointestinal tract is basis of the problem of hemostasis. The results of study will enrich the knowledge of the large intestine associated with vascularization and allow the study in mesenchymes by which a sequence the pathological associated with dysfunction are excluded. Yes, thank you for attention. It was about the today's presentation.
Thank you very much for your very interesting presentation. And as I'm not an anatomist, I'm a clinician, and I understand that the knowing about the morphology of visceral branches of abdominal aorta will help to provide some surgical operation if the surgeon knows about the when he is expecting the branch of aorta, it will be very useful. Thank you. Professor, do you have any questions or?
Thank you very much for this interesting report and study. And if there is some colleagues from the anatomy departments need to ask a question, we appreciate. So yeah, we can proceed for the next.
Thank you. And the last but not the least participants of our session is Nurhanat Junmabay from Aktobe, West Kazakhstan Medical University, and his poster is about the features of vascular endothelium of, and you are welcome. And Nurhanat, please switch on your video. Please, пожалуйста, включите свое видео, чтобы мы видели ваше лицо. Thank you.
Good afternoon, dear Chairman of International Symposium of Morphological Science and colleagues. Let me introduce myself. I am Nurhanat, PhD student of West Kazakhstan Marat Osmanov Medical University. My report's topic is specific features of biochemical markers of myocardial vascular endothelium jamming and the harmful effects of the environment. The aim of my work is analysis of the morphofunctional state of the arterial wall of myocardial vessels and the endothelial cells of the ventriculus of heart and the chronic exposed to sodium bichromate and the lindane. The experimental study was performed at the Research and the Experimental Center of West Kazakhstan Marat Osmanov Medical University on 16 white mice, 25 and 30 grams. The experimental animals were studied in 3 groups: control group, sodium dichromate group, and the lindane group. Sodium dichromate was administered at a dose of 5 milligram and the lindainidode dose of 100 milligram per dose for 2 months. During study, I have used some methods as histological, biochemical, and the statistical analysis of results was performed. Picture number 1. In the group of sodium dichromate poisoning, the endothelial layer consists of series of polygonal cells. However, in most cases, as cells include an XXVII control group, a number of changes of also detected in the nuclear rate of endothelial cells and the morphic cells increased scientific in both stages of poisoning campaign. To the control group, cells without fuclate increased 4 times in the first month and 3 times in the second month. In contrast, dual nucleate cells and 4.6 times smaller than in the control group. Picture number 2. In the group of Linden poisoning, heteromorphic cells in the first months of poisoning were 13.9 and 0.7 similar to the group on sodium dichromate poisoning. Also, the number of non-nucleate cells in the Linden poisoning group was 2.3 times higher than in the control group. The rate was scientifically low than in the group and the influence of sodium dichromate. Diagram. In the study of biomarkers, homocysteine levels increase in the sodium bichromate poisoning group compared with a control and the Linden group. During experimental coin poisoning with sodium dichromate and the Linden causes change in the vascular endothelium of the myocardium of found. The predominant changes of manifest in the group of sodium dichromate poisoning than in the group of Linden with an increase in the amount of biochemical markers, along with a question of integrity and endothelial cells. In particular, it was found that an increase of homocysteine gamete and endothelial cells is associated with increase in myocardial damage.
Nurkanat, you finished?
Yes.
Thank you very much. Because it is a very interesting work about the influence of our ecological environment to our health, and it is also a big problem for us, for Kazakhstan, because of using of many kinds of chemicals, and so it is very interesting work. Professor, do you have any points or questions?
No, thank you very much. It's really a great job, and hopefully it will help to manage in the future everything with the climate problem. Thank you. Thank you.
Thank you. And we finished our poster section. It was the last presenter. And I want to say some few words because, as I noticed previously, I am not anatomist, I am not physiologist, I am clinician. But for me, as for clinician, it was very interesting to know that in spite of 100-age history of anatomy, still now we have a big, huge amount of white spots of our human body. And knowing and advancing and promoting the anatomy science, it is very useful for all clinicians, not for me as an internist, but also for surgeries, neurosurgeries, ophthalmologists, and so on, so on, so on. Without basic anatomy, classic anatomy, physiology, and histology, the medicine has no future. And I'm so proud for you that you have such a great opportunity to join and to share your knowledges. And I wish you prosperities. I wish you healthy, be safe in our pandemic world. But also thank you for participation and doing me, separately me, more smart in anatomy science. Thank you very much.
Yes, thank you very much, Dr. Gaziza, for attendance, and thank you for everybody in the participant meetings. And really, I would love to do this meeting in face-to-face in Kazakhstan. I would like to have opportunity very soon to visit Kazakhstan.
You're welcome.
And to meet.
You're welcome.
And we pray all to see the participant soon, and to meet, inshallah, very soon for another meeting. Thank you very much.
Inshallah. Thank you very much for all participants. I wish you luck. Thank you.
Thank you.